I want to bring in epidemiologist and chief innovation officer at Boston Children's Hospital, Dr. John Brownstein, for more on this. Dr. Brownstein, you've been on the front lines throughout this pandemic, but you also worked closely with the CDC and the White House to help with the pandemic response. So what's your reaction to this report and the admission by the CDC director?
Well, good morning, Diane. I think the CDC does deserve criticism, but the first thing that we need to say is that these are the most hardworking, committed public health professionals that we have. They've been working nonstop for over 2 years now, significant amount of burnout. And, I've been working with them closely, and it's not necessarily the individuals, it's the funding, the bureaucracy, the hierarchy at the CDC that is failing them. So CDC really needs to improve their operational capacity to move faster, their clearance process, and this issue of a constant turnover of leadership. I'd work with one group, and then 3 months later, it'd be a different group. And that's really challenging to keep a response going. And so they have steps in place now to think through to how to evaluate and reorganize. But I think it's a long road to really regaining the public's trust in the CDC.
Now, this external review was ordered by Dr. Walensky herself back in April. Is it normal for the CDC director to order a review like this?
It's pretty unprecedented to see this level of transparency and effort to get at some of these structural issues. I think it's very unique, and it's incredibly ambitious. You have to change an entire culture of the CDC to align with its mission. We still need to see the details of what that will entail, but it's really important to note that some of these issues are really outside the CDC's control. The funding is tied to a response, so it's very hard to go into a response and then you have a monkeypox pandemic. That is a totally different response and new funding line. So they constantly have to shift and also have to deal with the challenges of working with state and local. So it's CDC issues, but there's also just structural public health issues that we have in this country.
Now, the CDC is acknowledging that guidance was, quote, confusing and overwhelming. And now Director Walensky says that she wants to share scientific findings and data faster rather than following an academic approach. Do you think that'll help, and what would that look like?
Right. Well, I've experienced this myself because we've worked together, try to publish findings, and it can take a really long time. And we know that there's been missteps in communication. Think about the challenges. We've talked about this, the challenges of masking guidance, booster guidance. It takes a really long time to publish. It's often confusing to academic. The approval process to getting this guidance out can take days, if not weeks or months. And it's not understandable by the public. And the website, as we know, is very confusing. So there's a renewed commitment to sharing scientific findings and data faster, and doing so in a way that the public can really understand.
And how do you balance sharing that data faster, sharing all the data coming in without overwhelming those of us who don't understand what some of this data means when it's, written in medicalese, and just get overwhelmed after a while by everything that's flying at us?
It's really, really challenging. There has to be transparency, but we have to remember the science is evolving over time. Our understanding of masking does change. We had a lot of scientists working on this, and we learned, for instance, about the nuances about high quality masks versus cloth masking. We're capturing data in real time. So I think transparency about what we know and what we don't know, and accurately reflecting that, we need a whole branch of science and public health communications. That's just generally really underfunded, and that's been exposed here in the pandemic.
And I also want to ask you about this new preliminary report on monkeypox vaccine. Officials are now saying that they're seeing breakthrough cases. So what do you make of that?
Well, no vaccine is a silver bullet. We know this with COVID. And so there's vaccine efficacy. We've seen historical data at about 85%. So it's not surprising that we're going to see some cases. This is not the only way to reduce risk. The way to prevent risk is additive. Getting vaccinated for those in high-risk groups is one way, but also, changing behaviors and making sure that we're reducing our contact with potentially infected people is another way. So it's not just one or the other. Like with COVID, it's the addition of intervention efforts that really reduces your risk.
All right, Dr. Brownstein, we appreciate it. Thank you.
Thanks, Anne.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.